On October 5th, 2003, David Spratt went out to dinner with his 17-year-old daughter. On October 11th, he missed the annual Pittsburgh-Notre Dame football game with his brother John. At this point, John knew that something was seriously wrong. By November 3rd, David was hospitalized for severe dehydration and abdominal pain. His family quickly learned that he had contracted hepatitis A, a potentially devastating liver disease. Fox News, November 20th, 2003 notes that doctors thought that he would recover quickly. But after just one day in the hospital, David went into liver failure. He spent the next 10 days incoherent due to the extreme medications being used to try and save his life. However, on November 14th, 2003, David Spratt died at the age of 46, having never been able to say goodbye to his wife Robin, daughters Jacqueline, 17, and Kristen, 12. The source of the infection was quickly traced back to green onions that he'd eaten just over a month earlier. What happened to Spratt and some 175,000 other Americans who were hospitalized each year due to contaminated produce is frightening. Even more disturbing is the fact that it could happen to anyone. But the agricultural industry in the US is clean and safe. This type of infection must be a fluke. Well, unfortunately, the produce which infected Spratt had been imported from Mexico. Today we'll discuss the dangers of infected, imported produce here in the United States. In a November 23rd, 2003 Seattle Times News article, Dr. Glenn Morris, chairman of the Department of Epidemiology and Preventative Medicine at the University of Maryland, stated that produce is emerging as an important cause of foodborne contamination, and we must understand how real the danger is. So first, we'll take a look at the problem at hand, then explore why more attention is not being given to such a serious issue, and finally, see what we can do to protect ourselves and to encourage our government to participate in our well-being. So, how many Americans are affected? How many people are at risk each year? Many, if not all, Americans eat fresh produce as part of their regular diet. As such, we're all at risk. Most of us heard about the recent outbreak of hepatitis A in Pennsylvania that caused more than 600 people to become ill and killed 3, including Spratt. What we were never informed of is the outbreak that occurred just 2 months prior in Tennessee, Georgia, and North Carolina. According to the Agribusiness Examiner, December 11th, 2003, this earlier outbreak caused more than 300 people to become ill. Yet the FDA issued no public warning until after the well-publicized deaths in Pennsylvania. Tainted produce is a growing plague that is leading to sickness and even death. On October 23rd, 2003, NBC.com reported that 40 people right here in the Southern California area contracted E. coli from contaminated lettuce, including children who ate the lettuce as part of their school lunch program. The Center for Disease Control's website, last updated June 27, 2003, reports that foodborne contamination leads to an estimated 76 million illnesses, 325,000 hospitalizations, and 5,200 deaths each year in the United States. Roughly half of these statistics can be directly attributed to fruits and vegetables. With such a glaring threat to public safety, we'll examine what is being done to protect our health and why this issue is not being given more attention. There are many possible sources of the contamination. The questions are almost endless. But CNN.com, December 2nd, 2003, lists a few. Is the water used for irrigation clean? Do the workers employ strict hygienic practices such as thorough hand washing? Are the vehicles used to transport produce also used to transport live animals, which could be a source of microbial contamination? We may never be able to know for sure, but according to tests conducted and published by the FDA in 2001, imported produce is more than 3 times as likely to contain dangerous contamination as that grown in the United States. And while the FDA has seen this danger with its own eyes, it continues to do little to control the problem. For example, the green onions which caused the outbreak in Pennsylvania last fall were traced back to the same Mexican farm that had already infected more than 300 people 2 months prior. Caroline Smith-DeWall, Food and Safety Director for the Center for Science and the Public Interest, stated on an interview on November 27, 2003, that some of the FDA's policies protect the food industry at the expense of the consumer. And in this case, delaying public notification may have cost lives. Worse still, according to the FDA's own website, last updated June 27, 2003, only 2% of produce is inspected for viral and bacterial contamination. This means that 98% of produce is being imported and distributed to Americans without any type of quality control. However, while the FDA is responsible for the safety of fruits, vegetables, dairy, and eggs, they have only 476 inspectors for over 420,000 food transport and storage facilities. By comparison, the U.S. Department of Agriculture, which is responsible for the safety of beef and poultry, has over 7,600 inspectors for just 6,500 facilities. This imbalance leaves the FDA incredibly short-staffed and deprives them of the opportunity to adequately monitor the safety of our fruits and vegetables. This leaves us with the important question of what can be done to protect our health. The answer to this lies both with government as well as with the individual. According to the U.S. Department of Agriculture, the President's Food Safety Initiative of 2000, $74.8 million was allocated to combat infected food. Yet, none of this money was given to the FDA to ensure the safety of our fruits and vegetables. Contacting your local senator or congressman and asking that the FDA be given adequate funding is an important first step. These people are voted into office, and if enough of us stand up and show our concern, they will listen. The next step is to inform the consumer of what they are purchasing. Nearly everything that we buy has country of origin labeling. The clothes that we wear, the cars that we drive, even children's toys. So why not our food? The Tariff Act of 1930 requires that all incoming goods have country of origin labeling. Produce is no exception. The containers that it's shipped in are clearly marked. However, this information is left in the storeroom of your local grocer, meaning that everyone but the consumer has access to it. Florida has had state legislation mandating country of origin labeling for more than 20 years. It's not placed any significant additional costs on grocers. The Florida Farm Bureau's May 2003 report to Congress says that this legislation costs about 1 to 2 man-hours per week, which breaks down to about 1 cent per household per week. I would gladly go pay my dollar for the next 2 years of service if they would label produce. In the meantime, stores do have access to this information. When I recently visited my local Ralph's, Albertsons, and Vons, all store managers were willing to tell me where the produce came from, with a little bit of prodding. I'm not saying that you should never buy imported produce, but since most infections such as hepatitis A and E. coli cannot be washed off, I am suggesting that it be thoroughly cooked before eating it yourself or serving it to your family. Am I saying that you should never eat raw vegetables? Of course not. I'm simply suggesting that you limit yourself to that which has been grown in the United States. The final step in protecting yourself is to get vaccinated. While it's not possible or even probable that someone would get vaccinated for every infection, it is feasible to cut down on the sources. The hepatitis A vaccine is an excellent first step. For those without insurance, this is available at low to no cost at community health clinics. According to the U.S. Library of Medicine, last updated December 2003, this is a series of 2 to 3 inoculations, administered 6 to 12 months apart, and the vaccine is good for 20 years. Today, we've taken a look at contaminated imported produce. We've seen why such a serious issue is not being given more attention, and finally, seen what we can do to protect ourselves and to encourage our government to participate in our well-being. It's disturbing that in this day and age, the safety of food in the United States cannot be assumed. But with knowledge, David Spratt might still be with his wife and 2 children. Fruits and vegetables are an important part of a healthy diet, and with action, we can keep these healthy foods safe for all.